Hey guys, it's Johnny here again from Stay Fit with the Smiths. Today I'm going to cover knee pain. So I'm just going to go over some common causes of knee pain and what could be going on if you do get knee pain and why that is. So often with knee pain, and this is with any kind of any joint in the body, I often find that normally where the area of pain is, it's often the symptom of something else being out of whack or out of alignment. So in the case of most people with knee pain, it generally starts at the ankle. So even though you probably haven't felt ankle pain, if your ankle isn't mobile and doesn't sort of do dorsiflexion and extension properly, so if we're not getting dorsi and plantar flexion out of that ankle, then it's really common for the knee not to function well. Because when you think about it, if your ankles are really stuck still and you try and squat but your ankles don't move, then you're going to end up squatting and then putting more strain on the knees. Whereas as you squat, you should be able to actually see that knee coming forward, tracking over the toes. So some things that we can do to help prevent knee pain are actually mobilizing the ankle joint. So I'm just going to give you guys a little tip you could do right now. If you've got a foam roller, that'd be ideal. If not, a can of baked beans or something would also be useful. So you can just sit down and then pop your lower part of your ankle. So we're going to go kind of right there on that soleus muscle or the Achilles tendon. We're going to put the other leg on top and we're going to lift your bum off the floor and just going to gently roll it. See how tight that feels? If you've got the strength, try and keep your hips off the floor and just keep pressing down on that. Now, rather than rolling back and forth, try and find a tight spot and hold it. So I'll get you to do sort of a few different trigger points in that lower part of the leg on both sides, or particularly the side where you've got a sore knee. Now what that's going to do is that's going to give you more what we call dorsiflexion, so it's going to allow your knee to then mobilize and come forward more than it used to. So that's the first thing, is loosen that. So roll that out with your baked bean can or your foam roller. Next part, which we commonly see in the knee, is the IT band being tight. Now that can be caused from lots of things like too much flexion extension or too much repetitive movement on the bike or running or whatever. So one thing we can do to help loosen that, if that is irritated or inflamed, is actually use that same can again. Okay, pop down onto your elbow. So we're going to put that just above the knee that's sore. And then you're going to roll, so you're going to put your other foot in front and you're going to roll over. And you're just going to massage into that tendon on the side. Now you'll probably find if that knee is sore, then this IT band is going to be tight as well. So find where it's tight, do the same thing, hold for at least 30 seconds. And then you can work your way up. So you can start by the knee, sort of work that lower part first, and then do sort of at least 2 or 3 different places. Remember, that muscle's 3D, so you've got to kind of change the angle of where you're rolling. So do that. So rolling out the soleus, rolling out the IT band. And then once we've done that, we want to try and get that ankle joint moving and that knee flexing. So what you're going to do then is a simple exercise where you just go into a lunge, and we're just going to try and press that knee over the toes and then pull it back. Okay, so we're getting a nice bend in the ankle now and at the knee, pulsing that back and forth. And then after that, because every case is different, so depending on your particular knees, without doing like a full one-on-one assessment, it's going to be a bit of trial and error. So if squats are good, then I'd keep doing squats. Glute bridges are fantastic. Lunges for most people are fine. So just find out what exercises don't cause pain and then give that a go. But another thing is, just to help see if this is actually going to help you, pick an exercise where it's a little bit niggly, like stepping up on a chair or whatever it might be, doing a squat or a lunge. Try it beforehand, see if there's any pain. If there is, or if you commonly get pain in that area, then set yourself up with your foam roller or your can, roll out that lower part, roll out the IT band, do that little exercise for sort of 10 reps, and then try the exercise again. See if there's any difference, and just let me know how you go with that.